The purpose of this video is to provide a brief overview of the nursing process. It will include the importance of using the nursing process, as well as the purpose and actions in each phase of it. The nursing process is important because it provides a framework for clinical decision-making, which helps to guide care and promote critical thinking. It is a systematic and goal-oriented framework for problem-solving. Critical thinking is used throughout the nursing process to improve client care. The nursing process is cost-efficient and a part of the standard of care. It is required by professional standards. The nursing process also promotes professionalism, enhances the quality of clinical decisions made, promotes collaboration with the client and interdisciplinary team, improves efficiency and timeliness of care, improves communication among nurses and with the public since it helps others understand what nurses do, increases client participation in care, promotes client autonomy and individualized care. While you will learn the steps in a sequence, in reality, the nursing process is dynamic and cyclical in nature. It is important to know the steps and be able to identify the purpose and actions in each step. ADPIE is an acronym that is used to help you remember the steps in order: assessment, diagnosis, planning, implementation, and evaluation. The purpose of the assessment phase is to establish a database about the client's response to health concerns or illness and their ability to manage healthcare needs. Basically, you need to gather information about the client. Remember to use your critical thinking to help you identify what information needs to be collected. In the assessment phase, nurses collect subjective and objective data about the patient in a systematic way through observations, interview questions, and physical examinations. Data is collected, organized, validated, and recorded. Subjective data is reported but not objectively measurable. You cannot see it. It includes verbal descriptions of health. Subjective data are often referred to as symptoms and represent things a client tells you that you cannot observe or measure. Most subjective data will be collected during a health history. Objective data, on the other hand, is measurable. Think about things like temperature, blood pressure, and weight. Objective data are often referred to as signs. These signs can be measured, seen, heard, felt, or smelled, and are often collected during a physical exam. For more information about data collection, please see the links to more videos below. Use critical thinking in the assessment phase to correctly interpret data. Are the data clear, precise, and consistent? Begin clustering cues and formulating inferences while you assess the client to guide further data collection. Recognize patterns and trends in the data and compare them with standards. Then come to a conclusion about the client's problem and move into the diagnostic phase of the nursing process. Formulating a clear diagnosis aids communication among team members. Nurses cannot make a medical diagnosis like asthma or myocardial infarction. However, nurses have an internationally standardized language for communicating clinical judgments. This language comes from NANDA International. Examples of NANDA labels include activity intolerance, decreased cardiac output, constipation, fluid volume deficit, and hypothermia, among many others. Nurses may identify an actual, risk, possible, or wellness diagnosis. For more information about how to cluster cues, recognize, and formulate a nursing diagnosis, please see the links provided below. Critical thinking about the client's condition is essential in the formulation of a nursing diagnosis. Concept mapping is one tool to promote critical thinking that aids in visualizing the interconnections between data gathered so that an accurate diagnosis can be formulated. Once nursing diagnoses are identified, priorities are established. In general, problems that have the potential to cause harm to the client or others if they are not addressed receive the highest priority. Then, non-life-threatening issues are addressed, followed by those that may affect future well-being. It is important to note that priorities are always changing, therefore continuous assessment of identified priorities is important. Maslow's hierarchy of needs is one framework that is commonly used to help identify priorities in nursing care. Physiologic needs receive first priority. This level includes life-threatening problems or risk factors that pose a threat to physiologic needs. For example, problems with breathing, circulation, nutrition, hydration, elimination, temperature regulation, and physical comfort. Safety and security needs come next. These problems or risk factors that pose a threat to safety and security include things like environmental hazards or fear. The third priority is love and belonging. These problems or risk factors posing a threat to feeling loved and a part of something come next. They include things like isolation or loss of a loved one. Problems or risk factors posing a threat to self-esteem, such as the inability to perform normal activities, comes next. Finally, problems or risk factors posing a threat to the ability to achieve personal goals are addressed. Once priority diagnoses are identified, goals or outcomes are established. These goals provide direction for the selection of nursing interventions, provide a focus for evaluation, are developed in consultation with the client, and can be short or long term. Goals or outcomes must be client-centered, singular, mutual, and SMART. SMART goals are specific, measurable, attainable, relevant or realistic, and time-limited. For more information about making and recognizing SMART goals, please watch the SMART Goals video. The link is provided below. Once goals are identified, interventions are developed and a care plan is communicated to the team. There are a variety of ways that care plans are communicated in the clinical setting. Interventions may be nurse-initiated, physician-initiated, or collaborative. For example, a nurse-initiated intervention might be to encourage the client to deep breathe every hour. A physician-initiated intervention may be to change the abdominal dressing twice a day. There would be an order to go with this intervention that would specify how to do the dressing change. A collaborative intervention may be to encourage the client to ambulate with a walker every 4 hours. In selection of interventions, consider the nursing diagnosis, goals and outcomes, evidence base, feasibility, acceptability to the client, and resources available. In the planning phase, critical thinking is essential to ensure that the plan is SMART. It is important that the plan is realistic and appropriate for the client. In the next phase, you implement the plan. Direct care is performed through interactions with the client. Examples include assisting with activities of daily living or physical care techniques. It may also involve counseling, teaching, or observing for adverse reactions, among other things performed with the client. Indirect care included in the care plan is performed away from the client on their behalf. Examples include advocacy, delegating, supervising, and evaluating the work of others. Ensure that critical thinking is used when carrying out the actions in the care plan. For example, you wouldn't want to give a heparin injection to someone with excessive bruising just because it says to in the care plan and orders. Reassessment of the client's condition should happen on an ongoing basis. In the evaluation phase, assess if nursing interventions have been effective or helpful in meeting desired outcomes. Has the situation changed? If goals were not met, what needs to be adjusted to help the client meet their goals? A decision will need to be made to terminate, continue, or revise the care plan. Evaluation should be completed throughout the nursing process. It is one of the most important steps requiring critical thinking to assess if what you're doing is helping the patient. If progress is not being made, find out why and revise the care plan. Thank you for watching this video. Please see the related videos below for more detailed information. Send me a message or leave a comment if there's anything you want to see more of.